You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Stellar Success Podcast with Dr. Tudor Francu again. We have Dr. Purva Merchant from Seattle, Washington. How are you?
I am good. Just finishing on the long work day here, so you caught me at a good time.
That's great. Let's talk about your work then a little bit. I was wondering, what do you think makes you successful in what you're doing every day?
I really think success is work in progress. So it is, a really good quote I read recently was that the only place that success comes before work is in the dictionary. And I think that's really true because it's never done. And the moment you reach a milestone, you sort of push your milestone further forward. So success to me is doing what I want to, when I want to, and having the resources and network to enable that.
Yeah, that's great. You are in a specialty that it's very hard, pediatric dentistry. Why did you do that?
Some would say hard, some would say fun. So depending on the day you ask me, my answer might be different. Why? It's a good question. Kids are exciting and interesting and real, and they just give it to you as it is. And I can't think of a better client than working with a child. Now, the challenging part is the parents. That's the hard part of the equation. So managing parents and parenting expectations in this day and age is I feel like my biggest struggle and challenge. The kids and the dentistry is the easy part.
Yeah, it's you're not only having one patient, one kid that you're treating, you treat the whole family because you have to deal with the parents, the grandparents, whoever is there with them.
And whoever's not there with them as well.
Exactly.
Yeah.
So tell us a little bit about how you get here. What did you do in the past? What was your journey?
Oh, wow. Okay, so I'll try to make it short and cut me short if I'm kind of going down a rabbit hole. Born and raised in India, I had a clear idea that I wanted to do some form of medicine. And as I started the medical journey, it became too vast. And so it became clear to me that I needed to specialize from the very beginning. So I did 1 year of medical school and then quit and then joined the dental school. As I approached the end of dental school, that felt really vast to me. As you can imagine, I am sort of like, when I choose a thing, it needs to be all in. I need to know everything about it. So I had to choose a specialty, and then came the question of like, what specialty within dentistry? With every other opportunity, I would have to drop something, meaning if I did oral surgery, I would never do a denture again. If I did prosthetics, I would never do a filling again. If I did orthodontics, I would never pick up a handpiece again. So pediatric dentistry felt to me like a specialty within a specialty, because I was learning all aspects of dentistry, surgery, orthodontics, filling teeth, growth and development, and adding to it behavioral management, psychology, general anesthesia, sedation, patient management. So thank goodness I chose that, because I feel like with my attention span being similar to a child's attention span, where in 30 minutes I'm bored, they're bored, my procedures are short, so I can be done and out. I think that's a long answer to your question. Why pediatric dentistry?
That's great. You really need to love the specialty to do it well. You know, it takes a lot of dedication, and I have a tremendous appreciation for people who choose this, because I remember when I did my pediatric anesthesiology fellowship, kind of a part fellowship. I remember it was like 6 or 9 months, something like that. It was probably the hardest thing I've ever done.
Why do you say that?
Career. Because it's you're dealing with a different human being. It's a different physiology. It's a different body size. Everything is psychologically different for the patient, and I can tell you how many memories I have from my own life being a kid and going to the dentist. And interestingly enough, my mother was a dentist, so obviously she was treating me, but I have very, so to speak, interesting memories from that time. So I want to ask you, how do you deal with trouble kids in your office?
So a couple of things
they're
to say
scared.
To you.
I can't imagine being a kid and going into an office to have a procedure and somebody, needs to, say, open your mouth and do something in my mouth without being like prepped psychologically, maybe anesthetized completely. How do you deal with this?
Sure. Well, a couple of things. First of all, it's like it's showtime, right? It's like the fast car comes into the changing thing, and the tire has to be changed like that, otherwise the car's gone. So keeping the child and family engaged at an age appropriate way. So how you manage a 1-year-old is not the same as how you manage an 18-year-old or a 10-year-old. So step one is watching. So trying to see the interaction between the caregiver and the child. Is this child hanging out behind the mom and hiding? Are they coming in marching down the road like, hey, my name? So first of all, it's like just watching and seeing and reading that dynamic. And that gets better with experience, as with everything else. In the beginning, when I first started, I must have gotten it all wrong. But I really think that being older now, I feel like I have a little bit more understanding and maturity and sensitivity approaching the room when I come in. So this preconceived idea that you're sharing, that it should be scary, is exactly the paradigm shift that us as pediatric dentists are making in the world. So I see a 40-year-old that comes in and they understand, not in my life, in my office, but in my life, and their first thing is, oh no, dentist. Talk to my patients and they're going to be like, oh yes, dentist, because it's like a spa day. They show up, they watch a movie, they have their teeth polished, they get a prize, they leave with a balloon. Sometimes they leave happy. I think it's all about how you present something to the child. If you are going to catch a 4-year-old child and say, okay, we're going to the dentist, okay? Make sure you listen. Make sure you open your mouth. Clearly, its child is like, what's up over here, right? Like, are you going to prepare them like this when you go to get dinner or to McDonald's or to Disneyland? No. So half the battle is what the parents are saying and not saying at home and the vocabulary that they're using. So my advice to parents is, we're the professionals. Let us do our job. Tell them the dentist is going to make your smile sparkly, and that's it. Our team is very well, experienced and knowledgeable as to how to make it exciting. So the child is skipping and hopping in. They're looking at all the stuff. This is a new office. It's a child-friendly office. There's ceiling TVs. There's toys. There's prizes. They come in. They're watching the other kids, because at a pediatric office, it's an open bay setup where you can watch all the other children as well. So children model behavior for other children, and that works really well. If someone's really poorly behaved, we hide them from everybody else. But if children are well behaved, we use them as examples for others to watch. And it's incredible to me how much a 2-year-old is capable of if they're given the right environment. So in an ideal world, the child is a little bit cautious, looks around, watches other kids doing it, sort of maybe jumps in the chair. We have vocabulary that we use with a tickle brush and a Mr. Thirsty and an air water squirter. And by the time you know it, they're having so much fun. The dentist comes in, does their exam, counts their teeth, plays music on their teeth, they get a prize, off they are. My point is, if you start early, before there is a problem, when you start in a prevention-based approach, then if and when there is an issue, the child is already comfortable, already trusts the office, and it goes very, very well.
Yeah, that's the best approach. You have your own practice, your office, correct?
That's correct, 2 now, yes.
How did you start this and why?
Oh, with a sandwich board. I mean, literally. So there was, I finished pediatric dental residency. I got board certified. I got my license for Washington State. And it was time to work. So when the time came to work, I started to look for offices that would be perhaps searching for a new pediatric dentist. And it was not as easy to find an office that was willing, because I was from out of state. So willing to take a chance on someone from out of state. And because I didn't go to school in Washington, I didn't have too many contacts. So what I did was I found an orthodontist's office that they were only working there 2 days a week, because I could see I was walking back and forth and the office would be closed half the time. So reached out to them and said, hey, it looks like you're not using your office every day. What if I started seeing patients here on the days that you're not here? Orthodontists like pediatric dentists because it's a practice builder for them. So if you have an office, if you have patients in their facility, chances are that those patients will stay on when it comes time for them to get braces and whatnot. Fortunately, it was a 2-chair office, tiny. I said, well, let's take a chance. Let's start here. And we did. And within 14 months, we outgrew that space, and it became time for us to brick and mortar start an office from scratch. And so we did. This is 14 years ago. Yeah.
Wow, that's great.
Yeah, I mean,
Awesome.
So literally with a sandwich board, I put a A-frame board outside the orthodontist office and saying, now accepting pediatric dentists. And I would literally be there watching families go by, hey, who's your dentist? Oh, you already have one? Great, come on in. Free toothbrush for you. And so, kind of like word of mouth, and for 1 to 2 to 5 to 100, and you know how it goes.
Yeah, that's great. Awesome. I'm sorry. I'm sure you had probably some um, setbacks in this journey over the 14 years, right? Can you give us an example of something that didn't work out
Oh,
and
so
kind of
many things.
made you more motivated to do the right thing?
So many things. I mean, every day I can think of something, right? Like I didn't I went to dental school. I didn't go to business school. I didn't go to how to set up a practice school.
Yeah,
I didn't go
that's a
to
different part of the podcast we're gonna get to.
yeah, and or how to hire appropriately or how to
Yeah.
do a dental claim. So you live and you learn, and I think that being able to pivot quickly, like catching yourself doing something that's not ideal, whether it's a review online that wasn't a 5 star, whether it is a competitor that might be doing something better, whether it is visiting other offices to see how they're running the show. There's always something to learn from everybody. So having that attitude of I'm willing to grow, I'm willing to learn, I'm willing to change every day, not just in the beginning stages of a career, but like every day, even today, there is something to learn and get better and get faster and get just humbler, maybe. So is that a word? I don't know. But anyway, the point is that like it's work in progress. And so if you have that attitude, then every occasion becomes a learning opportunity. So I've had wonderful employees that have become my colleagues and friends over the years that I've learned so much from. I've had parents who run businesses within the community that have become collaborators to help grow each other's businesses. I've had patients that have grown up and maybe like worked with us or interned with us for short amounts of time, and they've been an opportunity for me to grow and learn of how younger people are doing things, how new parents who are now in their 20s, that's my target audience now to try to get new patients, where are they looking for resources, social media, what kind of stuff is appropriate if I'm trying to attract a certain patient base, my suppliers. I work with some wonderful people in the medical field who are knowledgeable about equipment, technology, and the latest and greatest in my field, in my neighborhood, in my zip code. So I'm able to use them as guides and mentors to figure out what's appropriate for me in terms of the next investment in the business. So to answer your question, many things have happened over the last 14 years, and all of these have been learning opportunities.
Yeah, because sometimes we learn more from failures than success.
Always. Always,
Yeah.
right? Like in success, you're riding your high horse and you think you're amazing. And when something happens every day that you could be doing slightly better, those are humbling learning opportunities.
How is it to run your own office and your own business? Because you're not trained in this. We're not trained in this. Like I had the
Yeah.
same issue. I had to learn everything from the beginning. And if you're not a business person, how do you do it?
Well, you quickly become a business person. I mean, we're all the types of people that if you've chosen to become a board certified whatever within your field, you obviously have um, a standard of excellence. So if you have a standard of excellence, you're going to hold yourself to the same standard, whether it's your work or your business or your family life or your health, or that's just the standard for yourself. And I feel like that's the standard for the business. So when it comes to business owner, you put the new hat on where it's like, I know nothing. Who can I learn from? How can I make sure that this patient, this client that walks out the door becomes my marketing strategy, is the one that sends me the next new patient? How can I wow them so that they, in turn, will help me grow my practice? I don't know if that answers your question, but I feel
No,
like,
no, it's an interesting discussion because I've had many guests in this situation, and it's always an interesting fact for me that in medical profession in general, you have people that are graduating medicine. They're highly trained individuals, very smart people in general, and they're full of enthusiasm to practice medicine, but they have no clue about business, and the society expects from them to have their own office, their own practice, and they to do it well too. But there's no training for that. And sometimes you encounter people like yourself, right, who took the reins of their business office in their hands and they're running out with it and they're very successful with doing this. But what is the secret here for someone
yeah,
in our shoes to learn this business skills to be able to run a successful practice? Because it's not only about practicing medicine or dentistry well, it's about being successful in your practice as a business.
yeah, 100%. I really think that they don't correlate. Being a really good dentist has got nothing to do with being a really good businessman. It's businesswoman, I'm going to say. It's two different things. And some of us are the right place at the right time with the right people, and we figure it out, and others take a longer road to figure it out. I'm going to say a couple of things, maybe. One is surrounding yourself with the right people at the early stage in your career who are not in your field. finance people, business people, associates, equipment, people who are knowledgeable in their own fields that are different from what your expertise is. And the second is reading books, because there's so much to learn about, like just how to be a better person, how to communicate, how to hire the right people, how to Washington law or whatever law state you're in, jurisprudence, how to set up an office, how do you do a layout, how do you decide what questions to ask in an interview when you're hiring somebody. Like, it's like in life, you don't get a training manual. When you're becoming a parent, you don't get a training manual. You have some role models, you have some books, you have some podcasts, you have some people you follow as mentors, and then you learn and you figure it out. So I think it's the same with running a business. You make mistakes, you pick yourself up, and you keep going.
Yeah, that's very true. Especially these days, right? We have so many resources at our hands, and starting with simple YouTube channels, and people can learn so much from that only by watching others doing it and explain how to do it. And if you have the drive, like you said, if you have the drive to do this, you can find solutions. You can get people along with your goals to help you achieve what you want.
Some of the most successful business people we know, forget medical field, we're both in the medical field, but some of the most successful business people we don't necessarily have Ivy League degrees.
Yeah.
They have learned through hardship and through necessity and through do or die. And I really think that's the salt of the earth. These people are the ones that I have great value and respect for. So way more to learn from them than from any university or any education.
That's true. The school of life.
Yeah, and then why
sometimes
pay this
helps a
big
lot.
Ivy League? Yeah, why are you paying thousands of dollars to somebody when all of this information is available for free online,
Yeah.
like you said, on YouTube or whatever other channel?
Yeah, that's true. That's true. Now, going back to yourself, you are a very energetic and successful person, but there must be some habits and routine behind you that drives you forward. They drive you forward. And what are those? What do you think it's the most important traits you have to accomplish this?
I think this answer is going to evolve over the decades, but I'm going to just answer what I think is happening at this stage in my life. I don't think it was always like this. But the ability to, I'm practicing this still, the ability to listen and not react right away, to process. Some of it can happen through meditation. Some of it can happen through being quiet. Some of it can happen through reading. But listening more and talking less, absorbing more and acting on it. So actions rather than words, I really think is where the wisdom lies in becoming a better person, a better clinician, a better business person, and just a better human overall.
That's excellent. Yeah, there was a quote I remember when you said that, and they said it's always better to listen to think than listen to react. And I think that's basically what you just described. That's a quality that's not given. It's learned. It's learned behavior.
It's learned and it takes practice. It doesn't just happen.
Yeah. Now, what do you think is the most important thing someone in your shoes with a medical degree and a business to run should do for yourself to be successful?
Yeah, you've got to be the best version of yourself before you manage a business or a family or a community or whatever else. So
how do you do this? Be a best version of yourself.
Yeah, it's a very personal thing, right? Like, so to me,
Yes.
if I'm eating well and I'm getting good sleep and I've given myself some like quality me time, and in my world, that means a yoga class, a workout, a walk, a good book. If I've given myself, like nurtured myself in that way with quality ingredients, it's like garbage in, garbage out. If I'm reading good stuff, my mind is going to be occupied with inspiring ideas. If I'm eating nutritious food, my body is going to move in the best possible way. If I'm feeding my brain and my gut is clean, then my brain is going to be working in the most logical and systematic way. If I'm feeling good if I'm taking care of myself by like doing my nails, it means nothing to the rest of the world. But to me, I feel the most presentable. If my skin is clear, I'm confident and I'm approaching the world as the best version of myself. So that's important to me.
Yeah, that's a good point. It's a good point. Now, there are many questions about medical professionals and, dental professionals that are going around the financial aspect, retiring, the possibility of stopping the practice when you want, do have your time freedom. How do you see all these things from the financial point of view? Do you have certain strategies that you practice with money?
Yeah, 100%.
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
I really think diversification is the name of the game with everything. So what I mean by that is when I started pediatric dentistry, I would work 6 days a week because every business person does that, but that is not sustainable. And so you learn that after 10 years of doing it, like I'm watching people burn out and I'm thinking, I don't want to be that person. Okay, so how do I course correct now before I get to that stage? I found that working 3 days a week in pediatrics is my sweet spot, only because it takes so much energy from you to perform 40 times a day for 40 patients, right? The curtain comes on and it's like showtime, like a monkey, you're doing whatever you have to do. And then the curtain goes down and you're exhausted. So 3 days a week seem to be my sweet spot. And so how do you structure your life around making sure that is possible and feasible, whether it's bringing an associate into your office, working part-time in two. So the way I'm doing it is I work 2 days in one office, 2.5 days. 2 days in one office, 1.5 days in the other office. And now 3.5 days seems to be like the ideal work week for me. At the end of those 3.5 days, I still have 3.5 days of personal time, enough time for me to recharge and be excited about showing up to work again. At this stage in my life, this feels sustainable, this feels joyful, and this feels like it's balancing all sides of my personality without giving out. It's also money-wise diversifying. What I mean by that is like all my income does not go into the business. There's money that's going in other places. I know that you're big on real estate. That's one of my avenues as well. So having that buffer, like if I stop working today, how many years am I going to be okay before I have to start working again? And having that buffer being a little bit bigger and bigger and bigger every year just makes you operate from a space of comfort rather than from a space of I must or else. So that to me, having that balance and the ability to choose, whether you do it or not, you have the ability to choose. That is empowering, and that is liberating, and that is energizing. Because I'm not having to do it; I'm choosing to do it.
Yeah, that's a great balance to achieve. There are very few people who can do that, though.
But it's deliberate. It doesn't just happen.
Yeah, I know it's an intentional act to get to that point, and you have to be very wise in the way you do it. In terms of your investments, your quality of the people that you surround yourself with and you trust. And there are many people in our profession that, unfortunately, colleagues of mine and friends that are getting to a certain age where they practice their own life, they love what they're doing, but they cannot retire. And I don't know what the actual recipe for this successful point would be to have the choice of not practicing when you want it and say, okay, I'm done. I'm comfortable financially. Let me go do something else.
Yeah.
And I'm always trying to find, to finding guests the right approach in each of them. How do they achieve this point? What's your recipe?
Early on in my career, my dad had me read this book, which has stayed with me. Everyone's probably read it at some point, Rich Dad, Poor Dad. It's a valuable lesson in where you should put your resources early in life. So if you are going to continue to create liabilities for yourself, business-wise, professionally, personally, you're always going to be chasing a target and unable to get ahead of it. This idea of compound interest is such a simple one. Start early, put little away, be committed to that early, and the money will work itself for you. Let the money work for you, don't work for the money. So if there's a 20-year-old that's coming out, that's the first thing I would say. Read that book. It's a tiny little book. It's so impactful. Let your money work for you. Don't work for your money. So that's, I think, number one.
That's
Yes.
brilliant. And
Second, it's like, don't take loans as much as you can.
yeah,
Start
well,
using,
the society those days, it's built that way that you cannot accomplish anything in your education without taking big loans, and that's a whole industry for that. But yeah, I totally agree with you. I think people should look into investment strategies in the 20s. Most of them, they don't think of that. They think of buying liabilities or buying entertainment, but they don't buy their future. And the sooner you start buying your future in the 20s, the better you're going to be in the 60s. Rich Dad Poor Dad it's a book that not only should be taught in school, I think, but it's one of those principles that kind of will make the whole financial system go upside down in the school system. Because not only that we don't learn finances in school these days and business skills and all this stuff, but we most of the time we learn them wrong. And this book is one of those things that put, like you said, they teach you what's an asset and what's a liability. And Robert Kiyosaki was brilliant by just writing that book. It was, I don't know if you know the story, but it was a book written for his to explain his board game, cash flow board game. And that's how it became, a hit. But I would totally recommend that book to everybody. Dr. Merchant, with what you accomplished so far, the wisdom, the skills, the mindset, if you would look back to yourself when you started, what kind of advice would you give to yourself?
trust. I think I was afraid that I don't have it in me, as an immigrant, as a outsider, as a woman, as a woman of color, as all the things that are supposedly differentiators and making me a minority. None of that matters. If you have the drive, if you're good at what you do, if you surround yourself with the right people, and if you don't let negative people and negative things cloud your judgment. There's enough good people and positivity and yearning for other people to work with good people as well. So surround yourself with the best, always people that are better than you. And there's no limit to what you can achieve. So I would just have told myself, trust. You'll be fine.
Yeah, that's a great advice. How can people reach out to you and learn more about what you're doing? Maybe become your patients.
Yeah, well, thank you for that opportunity for the little plug-in. So I have a practice in Seattle called Seattle Kids Dentistry, one in Redmond called Redmond Kids Dentistry. These are both in the state of Washington. I'm quite active on social media, on Instagram at Dr._Merchant_Kids Dentist. So Dr. Merchant Kids Dentist, maybe you'll be able to link to that on your info. I'm on LinkedIn, I'm on Facebook as a public profile. And I figure that if anyone's going to put information out there about me, it better be me. I want my own information out there that I'm going to put out rather than some article that somebody's written about me, positive or negative. I don't know. I would rather be the one putting it out there in the world.
That's awesome. Well, I think this was very interesting, and I hope people will learn from this interview and become better and more successful. And I wish
thank you for this opportunity. This was really fun. Thank you.
Yes, absolutely. I wish you a lot more success, and maybe we'll circle back with you later in the year and see how you're doing.
Sounds good. I look forward to seeing you on the East Coast.
Thank you.
All right. Thank you. Take care.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to StellarSuccessPodcast.com /guest to apply. Stay stellar and level up.